Patricia Salcedo, Deidre Melton, Simplified. Starlina Terry, good afternoon. Ella Flagger, Sharon Fleming, Rochelle Bailey, Big Brother Bird, don't change the teaching. That's right, it's we not I. I'm going to teach on it. Gwendolyn Reynolds, Ronnie Vega, Mo said so. Natalie Hines, Renee Holman, Kanisha McMillan, Monique McKinney, Margaret Kelly Barnes, how are you? L. Monique Williams. Carly Henry, it's another day's journey, y'all. Ardelia McElroy, hold it down over there. Freddie Smith, Donna Sellers, Gwendolyn Reynolds, Lottie Smalls, Samir Mustafa, Terry Hurd, Venice Talaferro, Latanya Green, Chan, Janice Reddick, Jacqueline Harmon Johnson, Nikki Barnes, peace and love, mask up, Miss Ali, good to see you, Stacy Perry, Gwen Smith Stokes, I want to know if y'all know who this is, Jocelyn Brett, how you doing? Lucy Small, Donna Judd, Jackie Molina, how are you? Vanessa Davis, Golden Child, Minister Sonia Thomas, Barbara Gibson. Yeah, Manuel Guzman. You like that, Starlina? That's something. Tell me who's singing. Another day. Tawana Johnson. Good evening. Sharonda Bailey, Kim Moultrie, Stephanie Jones, Janine Hall, Tamika Darden, Deborah Petty. Oh, wow, Kim, you're celebrating the 60th. Happy birthday. Hold it down over there in Grafton Ave. Alisa Salam, Sandra Drayton, Christy Roaster, Rafiq Mormon, Peace, Anthony McFall, Bertilla Renee Simmons, Reese Purefoy, Elizabeth Ramos. At the site, which site? Testing site? Yo, the party pro, don't tell me that, because I'm going to get on the phone if you're telling me that if it's too crazy down there, I'm going to get on that phone. Yvette Rivera, Tamika Paul, Mary Moses Hunter, how you doing, Miss Moses Hunter, Hassan Marshall, Ida Austin, Anthony Mack, peace, brother, Constance Scales, Linda Barge, Gina Reynolds Muhammad, Clark Harper. Yes. We changing pipes all over the city, Marshall. Come on, this is come on now. We've changed over 13,000 pipes in the city. Take it easy, please. Michelle Davis, Dorothy Corona, Tamisha, just ask me. It's okay for us to be kind to each other. Just ask me. All you have to do is say the pipes are not done on our street. How can we get it done? You know, these kind of things, man. I'm going to talk about a little bit of that today. Come on, y'all. Michelle Carberry, Cass Sevilla, how you doing? Ruth Dennis Ellis, Karima Norman, Michelle King, how are you? Sal Lucci, peace. Nina Darby, Sajada Brown, how are you? Monica Green, Almeda Sad, Christian Austin, Renee Country Fields, Diane Galloso, baby is doing good, everybody's fine. First Lady, thank God. Ida Williams, how are you? Bernice Hall, I know that's right. Did you get on the call? Get on the call. We had another call today. We're going to do some more. Karama Thomas, peace. Geraldine Davis, Gloria Anderson, Bridget Butler. The funny thing about that, though, Bernice, is that people were saying we had it in our city already. I was telling them, we tried to tell them we didn't. D. Brown, Dawn Clayton, Brandy Patton Lopez, Charmaine Mark. Let me get to these. I got a lot of stuff to go over today, so I need to get to it. I want to show y'all this real quick. Go over a couple of things before I go into what I'm about to say. I want you to check out some of these newspaper articles, and I'm gonna tell you why I'm getting to this, and why I'm starting it this way when we're talking about COVID. So this one is first one from the Brennan Center .org. Voter suppression has gone digital. The Brennan Center. Just a couple of lines from that. Yeah, it says online voter suppression in 2018 shows similarities to Russia's interference in the 2016 presidential election, right? How has it gone digital? Deceptive practices have traditionally been compromised of fillers and phone flyers and phone calls. Now voter suppression has gone digital, right? And the goal is to suppress the turnout of non-white voters, particularly African Americans and Latinx. The night before Election Day, ads appeared urging people to boycott the election, right? There is a specific site put up by a fake site called Blacktivity that had millions and millions of retweets and likes, right? And they use deception to get these things done. Here's another ad. The online campaign to manipulate black voters. That's in the Crisis magazine, put out by the NAACP. New York Times, voter suppression and racial targeting in Facebook and Twitter and Instagram. March 9th, 2020, modern day voter suppression against, this is from the Baltimore Sun, against African-American voters is very much alive. We must address online voter suppression. BBC newspaper. Brookings Institute, setting the record straight on voter turnout. Goes on and on and on and on. And the reason that I'm mentioning that, and the reason that I'm going through that, is because there has been a concerted effort, and I wanted you to see the pattern of what has been happening by using Facebook, Instagram, Twitter, online accounts, fake accounts, and other people driving traffic to specific groups of people and specific demographics to get them to think, feel, and act a specific kind of way, right? In the 60s, the newspapers used to do it, journalists used to do it in something called Operation Mockingbird through the press. Now they don't need that. You have the social media doing that. And the reason I'm saying this is because this is the same tactic that's being used when we start talking about COVID and things like that. And why do I think that? You know, I've been having online discussions, I would say, with young people, younger African Americans, younger Latinos, mostly guys, around a specific thing, and they sound very, very, very much similar to Trump and these kind of right-wing folks. And they're using the same language, the same terminology, the same verbiage. One guy said it's a Democratic plot. Now I don't know where he got that from, except these people are targeting him with these websites, these pages. Somebody else put on there for us that we were violating people's individual liberties. These are young African-American guys from the neighborhood. We are violating people's personal liberty, he said, their personal liberty, and that people should have the right to come outside if they wanted to, if they were infected or not, because, you know, it's their life, right? And not considering them getting in touch or being around other people. These are the discussions I'm having with people, you know, in their 20s and 30s, young African-American and Latino guys in our community who are having these discussions with me. One of them said this was nothing but the flu. This is a young guy. It's nothing but the flu. When y'all gonna wake up and see that this is nothing but the flu and a government plot to do this, you know, make us do these things because this is just the flu. And I had to tell him the flu didn't kill 700 people in 3 or 4 months. Didn't happen. The amount of people that are dying, that are getting sick in our community is way past the flu. In fact, the amount of people that are sick from COVID in New Jersey is about 5, 6, 7 flu seasons put together. The number of people who've died from COVID is tremendous, and that the fact that it's focusing in now, we were saying it was the highest group of people that were getting it were African Americans. Now that's not even true. The highest group of people that are getting this is actually Latinx Americans, then African Americans that are getting this virus and that are in fact dying from it. And so these young people are talking this way. And then on top of that, I'm trying to figure out what did we do as adults and as elders to make them so self-absorbed and self-centered that they would actually buy into an argument that it is okay for them to go out and be sick, get sick, or even if they are sick, to go out and do these things because it only affects them and they don't care about anybody else. This is a mentality that we have not had. We have not had this mentality in generations that have come out of who have grown in this country. We have not had this mentality. that we don't care about other people in our community. We have not had this mentality. And I'm trying to figure out where it's coming from. And so I had to read to you the specific, and it's missed, a lot of people miss this, voter suppression and specific things that not just Russia, but the Republican Party and other kind of groups here have targeted our communities to begin to and use our same lingo, our same language, our same Black Lives Matter, Black activity, all of this stuff to convince us to, in fact, stay home. And I think the same tactics are being used around this whole COVID-19 and other things that are related to it. So I just need us to be careful with the stuff that we read, the stuff that we share, the stuff that we're putting out there. And if you read it, analyze it. If even the websites that I gave you, look at who wrote it, where it's coming from. Try to connect it to something else. Make sure that you're feeding yourself good food, right? And then we have to talk to our young people so they're not repeating the kind of craziness that's coming out of right-wing America, which is designed. These people have no desire to keep you alive. And if that's the case, then I'm trying to figure out why we are, in fact, following these people. And here was the effect of it. More news articles, but about New Jersey. New Jersey coronavirus transmission rate climbs above key benchmark. Death toll rises. That's NJ.com from 8 days ago. NJ.com from 5 days ago. New Jersey reports 489 new cases, 18 new deaths. Rate of transmission remains above 1. 10 hours ago, NewJersey.com. Coronavirus rate of transmission climbs to highest level in months as New Jersey reports 6 new deaths and 331 new cases. Coronavirus rate transmission climbs to the highest level in months. That's New Jersey. 10 hours ago. 10 hours ago. Yesterday, Philadelphia Voice. COVID-19 restrictions could be tightened if case numbers continue to climb, Governor Murphy says. That's a day ago, 1 day ago, right? So these are the news stories that are happening as a result of what I just talked to you about, and folks not listening, and they're coming up with all these reasons why they should not listen. And one of the articles that I couldn't find, and I wanted to find for you, broke down the infection rate by age. And I used to do that when we first started. I used to break it down by age, and the number of people that were actually getting it was high in between. We talk about 40 and 50, right? But the largest number of deaths was between 60 and up, right? So now in that article it says that there is a spike in the number of people that are getting it that are below 40, right? So between 20 and 30 that are getting it rapidly, Here's the problem with that, right? And so there's a small amount of people percentage-wise in that age range that are getting the virus, right? And so now that they're getting it faster now, more rapidly than anybody else, right? And they're getting it more rapidly and they're not dying from it. And that is the population that is mostly asymptomatic. So that means that there are a lot of asymptomatic carriers in that age group that are moving around the state. I'm not just talking about Newark, that are moving around the state in house parties and block parties and events that they're having. And they're arguing with us about why it's okay for them to keep having these events and why adults keep sponsoring and events so they could be a part of it, why they keep having these events. And as they have these events, the numbers climb. And as the numbers climb, the governor now is talking about new restrictions. And the irony of that is these businesses that keep promoting this stuff is going to be the death of their own business, because if the governor adds restrictions, we're going to go back. And I'm going to tell you before we leave what Newark's restriction is, our new restriction is before this Facebook Live is over. And before I also get into the numbers, I want to tell you, listen, we are having probably one of the most important Zoom virtual community meetings this Friday. We're going to have every captain from every precinct, the public safety director on. We're going to have Keisha Yuri of our new Office of Violence Prevention and Trauma Recovery there. I'll be on there. You should watch it on Facebook Live during our regular Facebook Live time, but you could get on Zoom. So there's a Zoom link. If you get on the Zoom link, you can actually participate in the discussion and ask questions to the panel if you get on the Zoom link. And that information will be available here on this page. You should be able to figure out how to get on the Zoom link and how to participate in that discussion. That's this Friday. We're going to have the captains of every precinct, along with the public safety director, the chief of police, and Lakeisha Yuri, director of violence prevention and trauma recovery, our new office that we just started, talking about what's going on, the spikes, where it's happening at, how we can combat it, why do we need community support, all those specific things. So let's get to the cases. Today we have 32 new positive cases in Newark today. We have 32 new positive cases with a total of 400 since June 30th. 32 positive cases with a total of 400. So we have 400 positive cases since June 30th. So in a month, right? In about a month, we have 400 people test positive for COVID-19 in about a month, right? And we've had 26 people die in a month. In about a month, 26 people die and 400 people test positive. And we have, in fact, been almost celebratory of this because no new deaths today. There's no new deaths today. I forgot. Nobody died today, and there's 32 more positive cases. But we do have 26 since the start of June 30th, which is a lot. 26 people dying in a month is a lot. It is certainly enough to take it seriously. And for us to still be having a debate about its seriousness is really nonsensical at this point. And we really should check ourselves about that. New Jersey, 182,614 positive cases. 182,614 positive cases, which is 585 cases today. New Jersey had 585 cases a day. At one point, we were averaging 200 to 300 cases a day in the entire state. There was a point when we were averaging 200 to 300 cases a day just in Newark. We have 13,971 deaths. 13,971 deaths in the state of New Jersey. 16 deaths today. Scaling back. When we were doing the reopening guidelines, we anticipated we would be beyond phase 4 by the end of July 26, right? So last week, we should have been at phase 4. Phase 4 talks about almost fully opening. We should have been at phase 4 last week. We should have been at phase 4 of our reopening strategy. Instead, we've been on a pause since about at least a month ago, and we have not gone inside. Governor Murphy today announced to extend this 30 days more. 30 days more. So we'll be in this holding pattern for another 30 days, according to Governor Murphy, which he announced today. And he's going to restrict, which means that indoor gatherings are going to take longer to happen. We were supposed to be indoors by July 26th. We're not there. The governor is being more restrictive, pulling back. And so he said another 30 days until further notice. Indoor gatherings that are not restaurants, that are not these places. Some of these churches and things that they allow open, that are allowing to open, have to have 25% of the room capacity. Has to be 25 people. He was saying 100. Now it's down to 25. This tighten the caps on the things that you have in and around your house. So if you're having backyard events, or house events, or other events, he's saying no more than 25 people. I would say in Newark, you should have no more than 10 to 15 people, right? First of all, you shouldn't be in strangers' homes because you don't know what the protocol is in their house. You need to be careful because those people are in your bubble. Whoever you're with, you have to stay with those people throughout this COVID-19. No new folks, no new people in your bubble. You need to tighten it up, right? We have to do what we can to keep our ourselves, our family, and other people safe, right? Couple of things you need to do: wear your mask, wash your hands, practice social distancing, cover your mouth when you sneeze or cough, avoid touching your face, get yourself tested. We know these things. These are the same things we've been going over for a very long time, right? So now on Sundays, folks, we're starting with Sunday. Sunday is an easy day. We're starting with Sunday in Newark. I'm going to have the order out tomorrow. Starting with Sunday, this Sunday coming. Starting with Sunday, we're going to close everything down except supermarkets and pharmacies. We're going to allow folks to open up in the morning, and then everybody has to close down. And we want the place, everybody closed before 8 p.m. And that is what's going to happen on Sundays. That is our first step. We are going to be more restrictive on house parties, on block events, on things that are happening in people's communities and neighborhoods that they have. People are going to be, if you have more than enough people in your backyard or something else, somebody's going to come and tell you you got to stop, or we're going to shut it down. We're going to close it down. We have to. The barbecues that are taking place outside, we're going to reduce the number of folks that are out there in those barbecues. We're going to start closing the stores down. All stores are going to close down except supermarkets and pharmacies before 8 p.m. on Sunday. We're going to monitor that based on the numbers, what it looks like on Sunday, what the numbers look like. We get the numbers on Friday. You'll see that. We're still going to do it on Sunday. And based on those numbers, I might add another day to that. And that's how we're going to do it. We're going to add day to day to day to day. So we start on Sunday. We shut everything down at 8. Next we'll add Monday, and we'll move on from there, right? So each day, each week, the numbers go up like that. We add another day, right? And if we have to go through the entire weeks by reducing those times, then we're going to shut things back down the way they were. And that is back to supermarket and pharmacy. And if it gets more restrictive, we're going to have to reinstitute a stay-at-home order. And we're going to be in touch with the governor's office to make sure that we're in sync with what they're doing here. But we're starting off on Sunday in the city of Newark. We're starting off on Sunday. Sunday is an easy day for us. Let's shut it down. Let's get some of the essential workers home. Let's get our streets clear. Let's begin getting back in the mindset of being restrictive about the things that we do. Where if we wore our masks, if we washed our hands, if we practiced social distancing, if we got tested, we can easily not go back into this place. Wear our masks, wash our hands, practice social distancing, and stop coming up with excuses why you can't wear your mask. Stop coming up with excuses. Listen, you have one more real month of summer left. Let's make it through August. Let's make it through August. Let's test. Let's wear our masks. Let's make it through August. Let's allow September let's move into September 10 times better than we moved into August. Let's hold it down for August, y'all. Let's hold it down for August. And at this rate that we're going, I would advise everybody to keep their children home for school. You know, at this rate, I would advise everybody to keep their children home for school. At this rate, I would advise everybody to keep their children home from school. If we can't get this thing under control in August, even the essential workers who a lot of people don't understand. Listen, some of our teachers teach, and they got kids that they have to stay home. They have to have a place for them. Some of our nurses and our healthcare providers have children, and they have to have the place for them. And we have to figure that out. They're folks, we have to figure it out for them. But at this rate, I wouldn't send anybody to school at this rate. The rate of we're growing, I would not send anybody to school. So pop-up testing, we're at Van Buren and Nichols today at 8 p.m. I got a report earlier. Hopefully my folks are watching that it was a little chaotic down there, if that's what they're talking about back at Eastside High School. Hopefully by now you got this thing tightened up. I know there's a lot of people out there. There's a long line because people need to get tested and they want to get tested. Yep. So get yourself tested. Van Buren and Nichols, they're down there today in the back of Eastside High School at 8 p.m. You know people that down in that East Ward, tell them to get tested. They down there at 8 p.m. On Wednesday, we'll be at Westside Park. On Wednesday, we'll be at Westside Park, right? on Friday. And I think they're doing antibodies down there at Eastside High School as well. I think they're doing antibodies down at Eastside as well. And in a lot of these places this week, we'll also be doing antibody testing, right? Antibody testing is just the blood protein that you develop in about 1 to 3 weeks if you have in fact been infected. So it'll tell you if you ever came into contact with the virus early on or in present. It'll tell you that. So Westside Park, Friday, August 7th, Clinton Avenue Soundstage on the corner of Clinton and Peshon. We'll be there doing testing at 8 p.m. as well. Friday, August 7th, we'll be at the Clinton Avenue Soundstage. Monday, Elliott Street Elementary School on Summer Avenue. Monday, August 10th, that's next Monday the 10th, we'll be at Elliott Street Elementary School. On Wednesday the 12th, we'll be at Zion Hill Baptist Church. Zion Hill Baptist Church in the parking lot. That's on Osborne Terrace. The Zion Hill Baptist Church on Osborne. I think it's Hawthorne and Osborne Terrace. Hawthorne Avenue and Osborne Terrace. And Friday, August 14th, we'll be back in the East at Oliver Street School. At Oliver Street School, we'll be at these places. That's at East Kenny and McWhorter. East Kenny and McWhorter. I want to give you a heads up that on August 6th, the U.S. Census Bureau will begin in-person follow-up with Newark households that have not yet responded. So people will be knocking on your door from the census. They'll be knocking on your door. They'll be knocking on people's doors who have not filled it out. The best thing to do is fill it out. If you don't want people knocking on your door, fill the census out. They're going to have on a mask. They'll be practicing social distancing, and they'll have a valid government ID badge. You'll see it. Don't let people at your door, if they don't have a government ID badge, look for that badge. Look for the mask. Ask them some questions before they start asking you questions. To confirm a census taker's identity, you can call the regional census center. If you see somebody's name and they look suspicious, you can call 212-882-7100. 212-882-7100. 212-882-7100. Or you could just bypass that and fill out the census today at www.2020census.gov or by calling 844-330-2020. I'm going to start coming out too. So if you see me knocking on doors with people, that's us trying to get you to fill out the census before the census takers have to come and knock on your door and you be scared to open the door for them. We're going to come out and knock on the door as well. I want to remind you that this Saturday is the West Ward Community Cleanup, and you can pick up your stuff from the Boylan Rec Center. You can pick up your stuff from the Boylan Rec Center on South Orange Avenue. That's this Saturday, West Ward Community Cleanup. I want to go back to the numbers. For people who just joined us, we have 32 more positive cases today, which gives us a number of 400 positive cases since June 30th. We have no new deaths today by the grace of God, no new deaths today. And we've been, our death rate has been going down tremendously by the grace of God. Thank you that the death rates have been going down with a total of 26 since June 30th, and 26 is still a lot, but we're just grateful that it has gone down. The rate over the state has increased. The rate in Newark has increased. That means the infection rate per day or the percentage of people that are getting infected based on the number of tests that we take, which means that we are infecting more people faster. And that's a problem for us. And the only way we fight back is wear our masks, social distance, get ourselves tested. That's the only way. Wear our masks, that's it, right? And I want to say two specific other things before I close, right? I want to reiterate it. One, so the NBA has a bubble, right? A bubble. And they call it a bubble because those are the only people they come into contact with. They're playing games without an audience, right? Baseball has started back up. They started canceling games. They get ready to scale back that because whole teams are getting infected. And I want to get us back in the mindset. And a bubble means, like we say in the community, no more new friends, right? So whoever you're with, like that, you have to be with them until the end of this. Doesn't mean you can't talk to people who do this, but when you're with other people, you have to be overly cautious with those people. Make sure you have on masks, that you're washing your hands, that you're staying away from them. Those people that you go and eat out with, say you're outdoor eating, or people that you are talking to on your porch or in your backyard, or folks that you're allowing inside your bubble, right? You have to understand, when you allow them in, you're allowing all the people they come into contact with in your bubble as well. So you just have to focus in on your bubble. And I know that that contradicts the concept of community, but we have to learn in this space, we have to learn how to be community and be community. There are ways that we can still do this without spreading this virus. And let's just be smart about that, right? Let's just be smart about that. The second piece is we have to rethink this school piece as these numbers go up, right? We really have to rethink what's going on, and we have to be very, very cautious of this. And if I were you, I would not on this day, August the 3rd, I would make a decision not to do it, right? Prayerfully, by the end of this month, we have wrestled this thing back down to a rate that is safe enough to at least take essential workers' children. And even then, we should not have more than 10 people in a classroom. And those 10 should have all of the amenities and resources that we can to keep them safe. Listen, this is serious. Don't get fooled by the propaganda, by the misinformation, by all of the stuff that they're putting out there, targeting your community. Websites. Look, this is a surefire way, because some people jump on my timeline and they say all kind of things, and then I look to see who they are. They have 0 posts except the one they posted you. 1,500 followers that they pulled in, right? And they follow like 7 people. Or there are ways to identify some of these people. Or you just listening to the things that they're saying. Check it out. Be careful. Be careful that people are not feeding you, and more importantly, feeding your children things that will march them down to a pathway of sickness and instability in our community and our neighborhood. It's important for us to be diligent, since we have evidence that people are targeting our community. We have evidence that people are targeting our community. We have to be vigilant and cautious and careful about what we feed ourselves and our children, and begin to make sure they have the right information. Anytime when a 26, 27-year-old young African-American man from the city of Newark starts talking to me in lingo that I just heard at a Donald Trump rally, I'm getting very cautious and nervous. Anytime when a young Latino have a conversation with me from Newark, New Jersey, saying things like it's our personal liberty to go outside even if we are sick, then we have to be cautious of where that's coming from. We really have to be cautious of where that's coming from. So on Sunday, this coming Sunday, everything has got to be closed before 8 p.m. There will be an exec order that says that. We're going to start with Sunday. We'll move to Monday. We'll move to Tuesday. We'll move to Wednesday. We're going to begin closing little by little by little, based on what those numbers look like and based on what the governor says. And at the end of that is all the way back down to stay-at-home order. And I don't want to get there. I don't want to do that. I'm not interested in that. It doesn't make me feel good. Or like I was talking to a young man on Facebook, it doesn't make me feel like a hero. I don't feel like a hero. I don't feel like all of these things because I have to do this. In fact, it is a hard decision. It is a difficult decision. It is a terrible decision. It destroys our economy. It makes it difficult for us to function as a city government, as city businesses. It is hard for us. It creates depression. It makes people upset. All of these things. But one thing it also does is it keeps us alive. Godspeed. See you tomorrow.